This is Gina from RN2 Professors with a video for you from my medical surgical series on chronic obstructive pulmonary disease, or COPD. In this video, I'm going to review questions on COPD. These questions focus on assessments and interventions for patients with this condition. I will show you how to determine what the question is asking, how to get the correct answer, and explain the rationale for the correct and incorrect answers. To get notified about more videos like this, click the subscribe button below and comment on this video. Here's our first question. The client diagnosed with an exacerbation of COPD is in respiratory distress. Which intervention should the nurse implement first? Number 1, administer oxygen at 6 liters per minute via nasal cannula. Number 2, monitor vital signs with the client sitting upright. Number 3, assist the client into a sitting position at 90 degrees. Number 4, notify the healthcare provider about the client's status. This is an application question in the implementation phase of the nursing process. To answer this question, you must choose the intervention to implement first. All the answers may be interventions that you will do for this patient, but what is the first thing that you should do? These can be tricky questions. Tips that I use to determine the correct answers are the ABCs and Maslow's. Also, you want to see if there's something that can be done right now without leaving the patient or getting help. And remember, if the patient is in distress, we do not assess. Now, with these tips in mind, let's take a look at the answers again. Number 1, administer oxygen at 6 liters via nasal cannula. This is not the correct answer. Oxygen will be applied as soon as possible, but too high of an oxygen level and the patient could stop breathing. This is due to CO2 retention that is often attributed to the increase of ventilation-perfusion mismatch, particularly during oxygen therapy. Number 2, monitor vital signs with the client sitting upright. This is not the correct answer. Vital signs need to be monitored, but this is not the first priority. Number 3, assist the client into a sitting position at 90 degrees. This is the correct answer. The patient should be assisted into a sitting position to decrease the work of breathing. Some patients prefer to sit on the side of the bed and lean over the bed table. Number 4, notify the healthcare provider about the client's status. This isn't the correct answer. The healthcare provider needs to be notified, but the patient must be treated first. Number 3 is the correct answer. We use the ABCs to determine that breathing was the priority and our tips to do what we could at the bedside first. Let's move on to the next question. The nurse is caring for a client diagnosed with end-stage COPD. Which data warrants immediate intervention by the nurse? Number 1, the client's pulse ox reading is 92. Number 2, the client's arterial blood gas level is 74. Number 3, the client has shortness of breath when walking to the bathroom. Number 4, the client's sputum is rusty colored. This is an analysis question in the assessment phase of the nursing process. To answer this question, you need to know what is expected and what requires intervention. Number 1, the client's pulse ox reading is 92. This is not the correct answer. A client with end-stage COPD has decreased peripheral oxygen levels. Therefore, this would not warrant immediate intervention. Number 2, the client's arterial blood gas level is 74. This is also not the correct answer. The client's ABGs would normally indicate low oxygen levels. Therefore, this would not warrant immediate intervention. Number 3. The client has shortness of breath when walking to the bathroom. This is not the correct answer. The client who develops dyspnea on exertion should stop the exertion, but does not require intervention by the nurse if the dyspnea resolves. Number 4. The client's sputum is rusty colored. This is the correct answer. Rusty colored sputum indicates blood in the sputum and requires further assessment by the nurse. Number 4 is the answer. 1 and 2 both describe decreased oxygen, which is a characteristic of COPD, and 3 does not require intervention by the nurse. Next question. Which statement made by the client diagnosed with chronic bronchitis indicates to the nurse more teaching is required? Number 1, I should contact my healthcare provider if my sputum changes color or amount. Number 2, I will take my bronchodilator regularly to prevent having bronchospasms. Number 3, this metered-dose inhaler gives a precise amount of medication with each dose. Number 4, I need to return to the healthcare provider to have my blood drawn with my annual physical. This is an analysis question in the evaluation phase of the nursing process. In this question, you're looking for incorrect information. You need to know patient teaching for self-care and maintenance. Number 1, I should contact my healthcare provider if my sputum changes color or amount. This is not the correct answer. When sputum changes in color or amount, or both, this indicates infection, and the client should report this information to the healthcare provider. This statement indicates the client understood the teaching. Number 2, I will take my bronchodilator regularly to prevent having bronchospasms. This is not the correct answer. Bronchodilators should be taken regularly to prevent bronchospasms. This statement also indicates that the client understands the teaching. Number 3, this metered dose inhaler gives a precise amount of medication with each dose. This is not the correct answer. Clients use metered dose inhalers because they deliver a precise amount of medication with correct use. This statement indicates the client understands your teaching. Number 4, I need to return to the healthcare provider to have my blood drawn with my annual physical. This is our correct answer. Clients should have their blood levels drawn every 6 months when taking bronchodilators, not yearly. This indicates the client needs more teaching. Number 4 is the correct answer. When evaluating whether a patient has learned the information presented, you're looking for incorrect information. This was the only incorrect statement. Next question. Which client problems are appropriate for the nurse to include in the plan of care for the client diagnosed with COPD? Select all that apply. This is an analysis question in the diagnosis phase of the nursing process. You need to know complications that can occur with COPD and which nursing diagnoses go with them. This is also a select all that applies question. You need to look at each answer individually to determine if it fits the question. Do not group them together. Number 1, impaired gas exchange. This is a correct answer. The client diagnosed with COPD has difficulty exchanging oxygen with carbon dioxide, which is manifested by physical signs such as fingernail clubbing and respiratory acidosis as seen on arterial blood gases. Number 2, inability to tolerate temperature extremes. This is a correct answer. The client should avoid extremes in temperatures. Warm temperatures can cause an increase in the metabolism and increase the need for oxygen. Cold temperatures can cause bronchospasm. Number 3, activity intolerance. This is also a correct answer. The client has increased respiratory effort during activities and can become fatigued. Activities should be timed so rest periods are scheduled to prevent fatigue. Number 4, inability to cope with changes in roles. This is a correct answer. The client may have difficulty adapting to the role changes brought about because of the disease process. Clients should be assessed for these issues. Number 5, alteration in nutrition. This is also the correct answer. Clients often lose weight because of the effort expended in breathing. All the answers are correct for this question. Therefore, you need to look at each answer individually and not think of this as a trick. These questions can have all the answers correct or only one. Let's move on to our last question. Which outcome is appropriate for the client problem ineffective gas exchange for the client recently diagnosed with COPD? Number 1, the client lists 3 signs symptoms to report to the healthcare provider. Number 2, the client will drink at least 2,500 milliliters of water daily. Number 3, the client demonstrates the correct way to purse lip breathe. Number 4, the client will be able to ambulate 100 feet with dyspnea. This is an analysis question in the diagnosis phase of the nursing process. To answer this question, you need to identify the outcome for the given nursing diagnosis of ineffective gas exchange. Number 1, the client lists 3 signs symptoms to report to the healthcare provider. This is not the correct answer. This would be an appropriate outcome for a knowledge deficit problem. Number 2, the client will drink at least 2,500 milliliters of water daily. This is not the correct answer. Increasing fluid does not ensure an effective airway. Number 3, the client demonstrates the correct way to pursed lip breathe. This is our correct answer. Pursed lip breathing helps keep the alveoli open to allow for better oxygen and carbon dioxide exchange. Number 4, the client will be able to ambulate 100 feet with dyspnea. This is not the correct answer. This is not an appropriate outcome for any client problem because the client should be able to ambulate without dyspnea for 100 feet. Number 3 is our answer. It is the correct outcome for our nursing diagnosis of ineffective gas exchange. Thank you for watching our video. If you liked it and want to see more, click the subscription button and the bell to be notified when new videos are posted.